Hi, everyone. I'm Phil Chang. Thank you so much to the Sarcoma Alliance for inviting me to be with you all today. Okay, there we go. All right. Okay, so for this session, I'm going to be giving a primer on exercise. So for anybody out there who is like an exercise guru or is a weekend warrior, feel free to kind of tune out. This may not be as useful for you. But for those of us who are not getting as much physical activity as we should be, then I hope to convince you that you should start. And as they say, the best time to start something was 20 years ago, but the next best time is now. Quick disclaimer here. Is this? Okay. How do I go back? All right, so this presentation is intended for informational purposes only, and it should not be taken as customized medical advice, and specific exercise recommendations and precautions should be discussed with your healthcare provider as indicated, and we'll get into that. So I don't have any disclosures, and the objectives for this session are going to be to recognize the benefits of therapeutic exercise, to discuss specific precautions before engaging in an exercise program, and to review exercise recommendations. But to get started, I really want to instill this idea that exercise is medicine. It's not just good to do because all of your doctors that you've ever seen have told you to walk more, but really it's a critical part of your treatment regimen. And if you do this, it will help you. And then more than that, it's something that you can kind of take control of and start doing yourself. We already know that exercise is medicine for your heart, and that people who engage in regular exercise will have a decreased resting heart rate. For those of you with higher blood pressure, it'll decrease your blood pressure. It'll increase your stroke volume, which is basically the amount of blood that your body pumps out to your heart with every single beat will be increased with regular exercise. And then it also reduces the amount of oxygen that your heart itself needs in order to operate at its best capacity. We know that exercise is medicine for your lungs, and those who exercise regularly will enjoy the benefits of having an increased maximum vital capacity, which means that the amount of air that you can breathe into your lungs to supply the rest of your body with oxygen is increased if you can undergo a regular regimen. We know that exercise is medicine for your muscles. And again, and those who engage in regular exercise will enjoy the benefits of having increased glycogen storage capacity in their muscles, which means that you'll have more fuel available for your muscles for them to actually contract and to do the job that they're supposed to. And moreover, it also optimizes your muscles' ability to use its energy systems. And then finally, as everyone's aware, with regular strengthening training, you can actually have growth and hypertrophy of your actual muscle fibers. We know all those things, that exercise is good for your body, but more importantly, we're finding that exercise is medicine specifically in cancer. And over the past several years, there's emerging evidence that exercise directly can control and affect tumor growth. So we know that exercise training can control cancer progression through direct effects on the tumor, that it can regulate tumor growth, alleviate adverse effects related to either the cancer itself or adverse effects related to cancer treatment, and that it can improve in some instances how well cancer therapies work. So I want to talk about a couple studies. I want to preface this by saying that this is all emerging evidence, and none of these studies are specifically in sarcoma populations, but the idea is the same, that through exercise you can we are finding that you can it directly affects the growth of tumors. So this is a study that they did in rats with lung tumors. And basically they divide the rats into two groups. One group, they gave free access to a running wheel. So these rats were just running to their heart's content as much as they wanted to. And then the other rats were not exercising at all because they did not have access to a running wheel. And we can see in the pictures on the right that the lung tumor volumes are represented by the areas in black, and we can see just this drastic difference that the exercising rats had markedly smaller tumor volumes compared to the non-exercising rats. This is another study that they did where they took a bunch of healthy young individuals and they had these individuals undergo high intensity interval training, which is a very specific kind of exercise. So they basically put them all on bikes and had them bike really, really hard. And after they finished biking, they took blood samples from them. They spun their blood down and then they took the serum from that blood and then they exposed the serum to human lung cancer cells. And they found that there's something in the serum of the people who had just exercised that reduces growth of reduce the growth and survival of these human lung cancer cells. And then finally, we see here, this is just a graphic from a recent review, but it's just basically summarizing that when you exercise, it mobilizes your immune system to basically directly kind of fight cancer, to inhibit growth and metastasis. So, for all these things, again, the evidence is emerging, and I'm sure there's going to be tons of more studies in the next 10 to 20 years. So, more limited evidence for this, but for other benefits of exercise, specifically in cancer, there's tons of evidence. We know for sure that this is like a real thing. And if you do this, that you will very, very likely get these other benefits. So one of those benefits is that exercise has a huge role in cancer prevention, and it prevents the occurrence of 7 common kinds of cancer, including the ones listed here: bladder, breast, colon, endometrial, esophageal, kidney, and stomach. Furthermore, exercise gives a survival benefit in those with breast, colon, and prostate cancer. And we can see that the reduction in all-cause mortality risk is quite substantial for all these populations. And then finally, we know that exercise has huge implications for quality of life. And again, this is something we know. This isn't emerging evidence. This is like based off of like dozens of studies and meta-analyses and reviews that have been done. So these are things that we're very confident of. So there's really strong evidence that if you exercise, you'll have improvement in your fatigue, your physical function, and it can also help with mood disorders, including depression and anxiety. And there's also moderate levels of evidence that exercise can improve your bone health, as well as with sleep. So hopefully by now I've kind of convinced you that exercise is a good thing that we should all be doing regardless. And, and you're asking, how much exercise do I need? How much, what exactly should I be doing? So the American College of Sports Medicine, or the ACSM, in 2018 actually got together kind of with all the big wigs in cancer and all the big wigs in rehabilitation medicine. And they reviewed all the studies that were out there, and they determined that to get all those benefits that we just talked about, you need to be getting 150 minutes per week of moderate intensity aerobic exercise, in addition to 2 to 3 days per week of strength training targeting your major muscle groups. Now, this is very similar to the guidelines set forth by the National Comprehensive Cancer Network, which basically states the same thing, but they state that if 150 minutes sounds like too much, and it is a lot, then you can kind of substitute that for 75 minutes of vigorous intensity aerobic activity per week. And they also throw in that you should also do stretching of your major muscle groups 2 to 3 days per week, as well as avoiding prolonged sedentary behavior. For anyone who doesn't really exercise on a regular basis, or maybe that hasn't been a part of their life yet up until this point, because tomorrow's a new day, there are prescription guidelines for, kind of a lighter regimen that you can start off with from the NCCN. So you could start at maybe a frequency of 1 to 3 times per week. Instead of doing moderate to vigorous, you could do light to moderate. And that could include aerobic and or resistance exercises. And really, you just start wherever you are. If you can walk for like 5 minutes, then you just start walking for 5 minutes. If you can do 10, then you start there. And then you slowly build up. And I've seen this in countless patients that, they are maybe not used to exercising regularly, but they start where they are. And really within like a month, you can double like your endurance. So, and this can really happen for most people. As they were reviewing kind of all these studies and saw the incredible benefits, they wanted to be really, really mindful that they didn't create any barriers to people starting on an exercise program because, it's a great thing and it can help you a lot and everybody should do it. With that said, they said that no assessments are required to start on the low intensity aerobic program or resistance training with gradual progression or a flexibility program in most survivors. However, they do recognize that depending on your personal history of exercise, as well as your personal medical history, some individuals may require some kind of medical clearance before starting on an exercise program. They didn't state what those risk factors were, but they deferred to the guidelines from the National Comprehensive Cancer Network, which we see here. So basically, if you have any of these issues in the upper left-hand box of peripheral neuropathy, arthritis, musculoskeletal issues, and then, poor bone health or like a bone issue or lymphedema, then they do recommend that you undergo a pre-exercise medical evaluation and that your exercise plan should be modified based off of the recommendations of that assessment. And then for kind of anybody in this higher risk category in the box on the bottom left, so if you have a history of lung surgery, abdominal surgery, ostomy, heart disease or COPD, ataxia, severe fatigue or severe nutritional deficits, or a worsening or changing physical status, then they do recommend clearance by a physician before engaging in an exercise program. They didn't really mention anything about COVID, but just a quick note, because cases are on the rise again. Obviously, if you are going to start on an exercise program in a community setting like a gym, then you want to follow recommendations, because the CDC does recognize that anybody with a history of cancer is at increased risk of severe illness from COVID. So you want to be sure to, mask up, maintain social distancing, and if you're able to get vaccinated, you should get vaccinated. Okay, so we talked a lot about the kinds of exercise you should get, either moderate, light, or vigorous. So what exactly is moderate or vigorous activity? Thankfully, they tell us in this slide also. It's just at the bottom in that really tiny lettering, so we'll zoom in there. So these have very specific definitions. So moderate intensity exercise is exercise that occurs at 40 to 59% of your heart rate reserve, or your VO2 reserve, whereas vigorous intensity is 60 to 89% of your heart rate reserve, or your VO2 reserve. Okay, so that's great. What do those terms mean? What is heart rate reserve and VO2? So let's just take a step back and talk about how we used to recommend people get aerobic exercise. So this is what we used to do. But basically, all we used to be based on your heart rate, and basically using your age, we would calculate what your estimated heart rate max is, which is 220 minus however old you are. And then, they would say, okay, so depending on your heart rate max, you want to be exercising at an intensity of 50 to 85% of that. So for, this guy who they'll say is 40 years old, that would be 90 to 153 beats per minute. If you're working out at that level, then you're doing aerobic, quote unquote aerobic exercise. So that's what used to be done. But that method did not take into account differences accounting for individuals' level of fitness. So, somebody who, doesn't really exercise at all is obviously different and will have a different heart rate than somebody who's a marathon runner. So for that reason, they came up with this idea of heart rate reserve, which really is basically how much extra your heart can beat, or how much faster your heart can beat beyond its baseline heart rate. So that number is calculated by taking your maximum heart rate and subtracting your resting heart rate, where again, your heart rate max is 220 minus your age. For example, we have our 40-year-old individual, and we'll assume he has a resting heart rate of 70. So his heart rate max would be 180. 180 minus 70 gives us a heart rate reserve of 110. And then we go back to our formula from the American College of Sports Medicine. And then we kind of plug in all the numbers, and we see that to get that moderate intensity level of exercise, you want your heart rate to be 114 and 135, assuming you're 40 years old and you have a resting heart rate of 70. And then kind of VO2, you do the same thing. So VO2 is the maximum amount of oxygen that your body is consuming when it is at its most active. And we calculate the VO2 reserve in the same way we calculate the heart rate reserve, which is the maximum minus the resting. The resting VO2 reserve for most individuals is estimated to be 3.5. To find out your VO2 max, you actually have to get on one of these treadmills and like put this mask over your face that actually measures how much oxygen you're consuming. That has to be done in a lab setting. So, you know, almost nobody's going to do that. So like, if you are really into this, then you can get one of these like fancy, like Apple watches or like Fitbit devices, and they can actually measure or estimate what your VO2 max is. And then, you know, you would just kind of use the same kind of formula to calculate, you know, what your VO2 is while you're undergoing aerobic exercise. All right, so that's probably a lot more math than you were anticipating in starting on an aerobic exercise program. So there's a couple other ways of, you know, determining whether you're getting that right intensity of exercise. And one of those ways is what we call perceived exertion. So this is the Borg scale of perceived exertion. And what you're going for a moderate level is, you know, somewhat hard. So if you feel like you're working out at a somewhat hard level, then more likely than not, your heart rate is where you need it to be to get those benefits that we're looking for. And then a second way is also from our NCCN guidelines. And for this method, you can basically use your work of breathing as a proxy. So for light exercise, you shouldn't notice any change in your work of breathing. But when you're undergoing moderate intensity exercise, you should be working out at the point where you can talk but not sing. And then if you're going for that vigorous intensity exercise, then you should be able to say a few words without stopping, but really not more than that. So, you know, if you don't have like an Apple Watch and you're not monitoring your heart rate, then I would say this is the way to go. Or, you know, that Borg scale, just like, I feel like I'm working out somewhat hard. Okay, so quick word on high intensity interval training. So for anybody who may be interested in doing this, because what high intensity interval training is basically you have a very short period of time where you're going all out. You're sprinting, you're like, you know, working out as hard as you possibly can. And then you go into a period of what we call active recovery, where you kind of slow down. You're still active, but, you know, you're kind of taking a break. And this has been shown to be really, really beneficial in the general population. It's also a way to potentially reduce the amount of like actual time you have to spend exercising. At this point, according to both the ACSM and NCCN guidelines, there's not enough evidence for this to be recommended in people with a history of cancer. So I'm just going to throw that out there. All right, so we talked about aerobic exercise. In regards to guidelines for resistance training, you just kind of want to follow this. So target all major muscle groups. You want to go 2 to 3 days per week, anywhere from 8 to 15 repetitions, doing 2 to 3 sets. And if you're doing something along the lines of that, then you're probably good. So there's you don't have to, you know, go to a gym. You don't have to have like a bunch of fancy equipment to start in a resistance program. You could either, you know, do body weight exercises, but what I prefer and is I think easier is you can just get a resistance band. So you can get resistance bands anywhere. They're, you know, whatever your preferred online retail market is, you could you can get resistance bands for like $10 to $30. I got this from CVS, but literally, you know, any sporting goods store, you'll really get resistance bands. I'll just demonstrate, you know, how easy these exercises can be to do. And you can just target all major muscle groups. Hopefully hopefully everyone can hear me. But as we see here, we want to get our back. So, you sit on the floor and then instant rowing machine. So super easy. And then if you can grab a chair with it back, you just throw the resistance band around the chair, and then you have an instant bench press. And then, you can tie the resistance band. So some of these resistance bands, they already come like in a loop. So I prefer, it would be best if you got one that's just in a straight line like this, and then you could tie it if you need to, but then you just tie it, and then you do clamshells, and that, instant abduction machine, and this is really good for strengthening your core and actually for helping with balance. And then you can drop it down towards your ankles, and then this is really easy. You hold one leg back, go forward on the other leg, and then you can get your quad muscles, and then you just go literally the opposite way, hold one leg forward, and then go back to get your hamstring. The pants and stuff are kind of slippery, so it's not working great, but I think you get the idea. And then there's also the biceps here. I won't demonstrate this one, but there's a bunch of different ways to do it. The other idea is that you, in addition to kind of aerobic exercise and regular resistance training, you just want to be active. So take the stairs or park in the back of the parking lot, because all movement really is, can be considered kind of exercise, and all exercises we've seen really is medicine. So just, take whatever steps you need to live a more fit life. And, a lot of these benefits, can, I think, be really helpful to a lot of people. So with that, I would be happy to take any questions.
Are there any questions from the live audience? Are there any questions from the folks watching us via Zoom? Stand by, Kaylee's is checking.
Hopefully that means I was really clear.
Yeah. We have one question that came in on the chat. Not done yet. The first question asks you what you have to say about people who are exercising regularly, who consider themselves, athletic, and who are doing lots of exercises but are still diagnosed with cancer. What are your thoughts about that? And
I would say keep exercising, keep staying really active. It will only help you. So what I can say is, as we've discussed, if you follow those recommendations, you will likely, get kind of all those quality of life benefits. But furthermore, this is more anecdotal, but for most people that I see like going through active treatment, people who are like really, really physically fit tend to overall maybe just tolerate a little bit better. So if you are really, really active, just keep doing it. It's only helping you. Most like, yeah, in most cases, it's really probably only helping you.
thank you.
Yep.
And what do you recommend for when people are tired? Would you recommend that they not exercise at all, or what are your recommendations for
Yes. So yeah, that's a really good question. If you're tired and you need to rest, then you absolutely should rest. Especially if you're on active treatment. I mean, you're just going to there's going to be times where you just can't, your body just won't want to, and you shouldn't. You should just take those days off and rest. But on those days where, you are feeling like you can, and maybe you just don't want to, I would recommend that you push yourself, and that you just do it. Because again, we're just looking for 2 to 3 days per week of strength training, and then 150 minutes cumulative kind of throughout the week. So you can rest you should rest when needed.
Yeah. Are there any Zoom exercise classes that are specific to cancer patients that you recommend? It is easier to get motivated if you participate with other people who are facing cancer.
Yes, yeah, that's a really, really good question. So there's no specific Zoom exercises specifically for people with cancer that I'm aware of. There are multiple applications out there for people with cancer. And at Cedars-Sinai, we are fortunate to have what we call our cancer exercise recovery program, where you kind of participate with a personal trainer, exercise trainer for 12 weeks. So no, I'm sorry, I don't know of any specific Zoom resources that are available. But yeah, there are some applications.
Thank you.
Yep.
Does anybody in the live audience have any questions for Dr. Chang?
Wait for me. Is it on? This is really a follow-up to the question from the Zoom person about should you exercise or not. And I'll just, as a person who was there, I'll give you a third option to should you exercise or not. So I went through cancer like many of you. So my protocol for chemo was doxorubicin and cisplatin. I was a marathon runner before. It kicked my butt. Sorry, didn't matter how good a shape I was in. I got every side effect in the book. The third option that I will say is there are many days when you don't feel like exercising, and it's the cancer or your mind just messing with you. So I'm queuing up the next speaker too. So what I had to do, there were times when I couldn't tell, am I just beat? Or is this the cancer or the treatment or whatever messing with me? So I would, make these deals with myself, and I would say, all right, go downstairs and walk to the mailbox. If you're beat after that, come back, or, okay, you got to the mailbox, walk down to my condo complex has a swimming pool. Get down to the swimming pool and see how you feel, right? And it's still that same, there's still that debate. So, but that was how I was able to discern if my mind was messing with me or if I was just really beat. So.
Yeah, no, I think that's an absolutely great point. Like you could just try, like see what you can do. And, if you can't, then just rest. Yeah, I thank you for that. That's a really good point.
Yeah.